Now we want to get the latest updates from the head of the St. Louis Metropolitan Pandemic Task Force. Dr. Alex Garza is also the Chief Medical Officer for SSM Health and joins us live. Dr. Garza, always appreciate your time. I want to start with, in the past week, health experts came out saying with this new virus variant spreading, we need to avoid any additional or optional trips to the grocery store and cut down on the time we're spending there. Is this advice that you agree with?
Well, yeah. So anything that we can do to decrease the risk of transmission. So really the question is first of all, is that variant within our community? And secondly, how much of it is within our community? And so we do think that it eventually will show up. We haven't found it yet, but eventually it will. And if it does become the predominant strain, then you're trying to then reduce your risk of transmission. And so that's what leads to those recommendations of decreasing, your risk of running into somebody that has the virus or potential for transmission at a public space, things like that. But really anything that you can do to decrease transmission is a good thing.
Something else that we're hearing that could possibly be decreasing that transmission is experts are saying now that we need to upgrade our masks or maybe even double up on the masks that we're wearing. Is that some advice that you would give?
Yeah, there's been some stuff out in the media about people moving from like cloth masks to surgical masks now that the production has increased for PPE and other things like that. And there are some advantages to doing that. The surgical masks do offer more protection than your sort of ordinary cloth mask. And so again, it's just another added layer of protection. How much more it would decrease transmission is sort of unknown, but every little bit helps.
And with that in mind, should we be discouraging people from possibly going out to restaurants and shopping in stores, or is it possible that we may need to just shut them back down at some point?
Well, I think that's going to be dependent upon which way the cases are going and hospitalization. So clearly we have opened up part of the restaurants and bars, at least within St. Louis County, and then some of the other places have been continuing to serve patrons. And so I think if people take a common sense approach by limiting, the number of people that are in restaurants, consistently wearing masks unless you're eating, not gathering in large groups, that we can balance, these mitigation strategies with still doing some things that we like to do in normal life.
And while we're balancing those mitigation strategies, we're also all waiting on our turn to get the vaccine. We know that Missouri and Illinois continue to lag behind the rest of the nation in vaccine distribution. You're somebody in charge. Can you answer why we can't get this fixed and who should be held accountable?
Well, when I went back and looked at the CDC website this morning, it's sort of a mixed bag. And so, yes, Missouri was amongst the lowest, if not the lowest, with that first dose immunization, but was actually one of the highest ones in the second dose immunizations. And then if you look at the amount that's been distributed to the state of Missouri, it's one of the lowest where it's been distributed, meaning how much they've received from the federal government. And so some of that stuff is understandable, why you're having a lower sort of penetration of that first dose. But really, I think the goal is to get as much vaccine out into the community as you can. And I know just from working with our community here in St. Louis that they've been working at a fast clip trying to get everybody vaccinated if they possibly can. So certainly more work needs to occur. Certainly want to increase that rate, but part of it is the vaccine coming into the state as well.
Okay, Dr. Garza, I do appreciate you taking the time with us this afternoon. Always good to get your insight on some of the concerns that we have surrounding the virus and the vaccine distribution.